we got Cynthia and Dr. Smith just checking in. Okay, we good to go? Well, good morning, Queensland. It's wonderful to be back in Cairns, and I'm here with Minister Crawford, the member for Bowen River, and also Cynthia Louis, the member for Cook, and also Deputy Chief Health Officer Dr. James Smith. And Cynthia and Dr. Smith and I will be travelling this afternoon up into the Cape and Torres Strait Islander and spending today and tomorrow talking to many communities about the importance of getting vaccinated, because the virus is coming. We've had more cases today. We know that when the borders open, that this virus will come into every single community and every one of us will be exposed to this virus. How you react to that virus will depend on whether you are fully vaccinated or not. And we know that there is an 86% chance of not contracting the virus if you are vaccinated, and a 90% chance of not dying from this virus if you are vaccinated. So that's a pretty good incentive to go get vaccinated. And we also know it significantly reduces the transmission of the virus to other people if you are vaccinated. Now today I'm making two important announcements on top of the announcements that we made yesterday about mandating vaccines in a number of different businesses and facilities. Yesterday we announced that any visitors to hospitals, aged care facilities, disability facilities would need to be fully vaccinated unless it is an end-of-life visit, a palliative care visit, or a birth of a child. Now, can I be clear? This is visitors, not patients. Anyone needing hospital care or health treatment, whether they are vaccinated or not, would still have full access to our health services. This is about visitors coming in. We have already mandated that all public health workers in our hospital setting and aged care facilities must be fully vaccinated. We've already done that. Today I announced that we are extending that public health directive to all health facilities in Queensland, all private hospitals, community pharmacies, GPs, physiotherapists, all of these services. Every health facility or health worker who goes into other facilities will need to be fully vaccinated by the 15th of December. This is in line with the AHPPC directive, and just about every other jurisdiction are now putting in these mandatory requirements for our health workforce. It is really important that no matter whether you turn up at a public hospital or private hospital, your GP, your pharmacy or other primary or allied health care, that you have the confidence that that workforce is fully vaccinated and there is less chance of them passing the virus on to you. And it also means we're going to have the workforce we need when the virus does spread through our communities, because they're not off sick with the virus. The other important announcement that I'm making today is the criteria for home quarantining when we hit 70% double dose. Now, people who meet this criteria will have the certainty to now start booking flights to come back to Queensland, whether you are a Queensland resident or whether you are someone seeking to relocate or visit Queensland. If you meet this criteria, you will be able to fly in from the 19th of November. It's possible we will hit the 70% double dose earlier than that, but you can be assured that you can start making plans to arrive in Queensland from the 19th of November. The criteria is this: you must be fully vaccinated. You must have had 2 doses and it's 2 weeks since you've had your second dose. You must have a negative PCR test in the 72 hours before you travel. You must have a residence that you can quarantine in, and that residence must have direct fresh air access to your door. No sharing of common areas. What do I mean by this? So obviously if you have a standalone home, you can quarantine in that. If you have a townhouse, that you have a direct access to the front door, without going through common areas or shared areas, you can quarantine in that. If you live in an apartment block where your access to your front door is directly through open areas and you're not having to go through covered walkways or common shared walkways, you can quarantine in those areas. You have to be able to fly in, either direct from Victoria, ACT or New South Wales to your port of call, so direct to Cairns, and you must be able to arrive at your quarantine residence within a 2 hours drive. You can transit once through the Brisbane airport. So if there are no direct flights from interstate, you can fly into the Brisbane airport, remain at the airport, and then transit to one other flight. Now let's be clear, that means people from Victoria, New South Wales and the ACT will be getting on flights, travelling right across Queensland and then home quarantining. That means there is a risk of this virus coming into the community from the 19th of November because these people will be on public flights with other people who are travelling around Queensland. So you must be able to fly in with only one transit stop through Brisbane. You must be able to drive within 2 hours. You must have your own private transport or government organised transport or a contactless hire car, as in you haven't had to contact or have any engagement with people. And if there are other people in your household who are going to be there while you're home quarantining, they must quarantine with you. There are other requirements about complying with the testing regime while you're in quarantine, and also there is the requirement to ensure that you are complying with the check-in system that we have set up to make sure people are staying at home. This means thousands of people will be able to come into Queensland from the 19th of November who have been in hotspots. This means that there is more reason than ever for people to come out and get vaccinated today to get the protection they need, because this virus is going to come into our community. This is the right thing to do. It's a balanced, reasonable approach to letting people come into Queensland, but it does come with a risk, and we ask people to come and get vaccinated. Also, of course, to get tested. So if you are interstate or you have a loved one interstate who have been trying to come into Queensland, later today, that criteria will be put up on the website. People will be able to look at that criteria, see if they meet that criteria, and they can start booking their flights. The only thing that will stand in their way, if they meet that criteria, is if they don't get a negative test before they fly. So this is great news for people interstate. It's a great step forward for Queensland and opening up Queensland to visitors and returning residents and people wanting to move here. But we need you to come and get vaccinated to protect us all and to keep us safe. I'll now ask Dr. Smith to just talk a little bit more about our cases, and reminding everyone we've had recent case in Cairns. You are just as much a risk in far north Queensland as you are anywhere else in Queensland right now. Come get tested and make sure you are getting vaccinated. And then I'll ask Minister Crawford and Cynthia to say a few words. Thank you, Dr. Smith.
Thank you very much, Minister. Look, I'm aware that Dr. McKinlay gave more detailed summaries earlier this morning at the press conference of each of the cases, so I'll keep it brief, but essentially what we've seen is 3 cases in the last 24 hours. One was in hotel quarantine and a woman who had recently arrived from Melbourne. The next one is more concerning. It's a man in his early 30s on the Gold Coast who has 3 very close contacts who have all fortunately tested negative so far, but has also been in healthcare facilities. And I guess the big concern for us is the upstream issue. So how did he in fact acquire this infection? And there's a big body of work going on down at the Gold Coast at the moment to look into that and to try and figure out how he acquired his infection. The next case is a man in his early 20s in Warwick, and he has a direct relationship to the outbreaks that we've seen in particularly in Moree, but also in Goondiwindi in recent times, and he's known to be a contact of of someone from that cluster. He's not vaccinated and he's a First Nations man. So I guess it goes to show that they're three very distinctly different geographic parts of the state. And of course, over the weekend we had an issue with a case that had been in Cairns and Mission Beach in the preceding week. What we're seeing now is that cases are popping up anywhere. Because you live in a regional or remote setting does not in any way mean that you're somehow immune or exempt from being exposed to this virus. And what we're expecting is that it will pop up anywhere, and that where there are communities with lower levels of vaccination coverage, it will rip through those communities. And if those communities happen to be in areas where there are limited health services that would normally cope under normal conditions, they may really struggle when the number of cases increases and they're trying to cope with their usual work as well. So that makes it even more important for people living in regional and remote settings to be fully vaccinated in order to reduce the burden and the pressure that'll be placed on health services when those cases inevitably come into those communities. And this week we saw some interesting data released from New South Wales where they looked at just under 62,000 people who had coronavirus between when the outbreak down there began on the 16th of June and early October. And what they saw was that people who are vaccinated were 10 times less likely to have developed coronavirus and 16 times less likely to have made their way into intensive care or to have died from COVID. So there's some really astounding statistics and really go a long way to reinforcing some real-world Australian data there and go a long way to reinforcing just how important it is to get vaccinated to protect yourselves and the communities that you live in. Thanks very much.
Good morning. Craig Crawford, local member here and also Minister in the Palaszczuk government. What you can't see behind the cameras right here has been the slow and steady stream of people that have been coming in to the Cairns Convention Centre here for the vaccination hub. There have already been 20 to 25 people who have wandered past the backs of all the cameras coming in and getting the much important vaccine. And many of those people I've noticed just standing behind there, many of those people have been younger people, the 16 to 39-year-olds that we are targeting most. A big message for the people of Cairns right now. If you're watching this stream on social media and you haven't been vaccinated, come right now. There is no line-up. There is no line-up here at the Cairns Convention Centre. You can come in right now and you can receive that important vaccination. It may be the difference between whether you can go to your work on the 17th of December. It might be the difference as to whether you can go to the pub with your mates on the 17th of December. But it will also make a big difference to the city of Cairns because our economic recovery relies on our vaccination rate to be high enough to resist any possible means of transmission in this city. And that transmission will occur on the 17th of December when that first flight arrives. So it is up to the people of Cairns to roll up the sleeves, get vaccinated for us, for our city, for our economy, for your mates. The second thing I'd like to take up is a response yesterday by Cairns Regional Councillor Brett Olds to yesterday's government announcement. Can I condemn Councillor Olds for his statements yesterday? He compared the government's announcement yesterday to apartheid. If you speak to anyone who endured the South African apartheid, they'll tell you that they were not in a position to change the colour of their skin. They were not in a position to change their ethnic background. Unvaccinated Queenslanders are in a position to get vaccinated. You hold that power, not the government. Councillor Olds needs to get vaccinated or Councillor Olds needs to resign. Thank you.
Thank you. our borders will open and Delta will come. That is the strong message that this government is putting forward to all of our communities today. It's wonderful to have the Health Minister back in Cairns this week. In Far North Queensland, we're travelling to the Torres Strait as well as the NPA in Cape York. It is critical that all those communities, those remote and regional communities, we need everyone on board to get their vaccination. We are in a really good position that while we have time, before the borders open, we need to get every single person vaccinated in this state. This is the only way forward through this pandemic. Queenslanders have done so well to this point. We've still got another challenge ahead of us, and it is up to all of us to work together to make it happen. Thank you.
I also just I want to thank the mayors. This morning, Minister Crawford and Cynthia and I met with many mayors from the Cape and Torres Strait Island. We also met with councillors from the Torres Strait Islander Regional Council who were down here meeting. And it was wonderful to talk to them about what's happening in their communities and, importantly, what more we can be doing to increase the vaccination rates and break down some of those myths. We'll be taking the questions and the issues raised by those mayors back to Queensland Health, having conversations about what else we can be doing because we want to work together. We all want the same outcome, which is our communities safe by getting as many people vaccinated as possible. So I thank those mayors for giving me their time this morning. I look forward to visiting their communities over the next couple of days.
Minister, on that, some of the communities on the Cape are at 25 and 30% vaccination. Is it wise to be opening home quarantine in November?
Well, we have to draw a line in the sand and say at some point we have to have our community opening more, both to Queensland residents who have been stuck interstate in some cases for many months, people who are wanting to move here, people who are wanting to come visit loved ones for a range of reasons. It's important we start moving towards that. If it's not at the 70 and 80% mark, when is it going to be? Now, it is one very clear message from the Premier. She's not going to start dividing the state up. It's 80% double dose across the state, or it's 70% double dose across the state. We're not going to start saying the communities that have low vaccination rates will be locked down and we won't let anyone into those communities. That won't work. We're all one state. We need to all come together, but it really is in the hands of the individual to come forward and get vaccinated. But I do want to say the risk to pregnant women, the risk to children. Over 2021, the majority of people that have ended up infected with COVID are between the ages of 0 and 39. They're the largest group. So we need to protect our children who can't get vaccinated, who are under 12. We need to protect our women who are pregnant, who are far greater at risk of ending up hospitalised in an ICU from this virus if they're unvaccinated. And the most recent data I've seen is in New South Wales, almost 200 children had both parents in hospital at the same time from COVID. They had no parent to look after them. We can't afford for this to happen. Let's make sure we're looking after our youngest and our eldest in our community by getting vaccinated.
Minister, will the jab be mandated for all public servants, and if so, why?
So we haven't mandated that as yet. What we have announced is that we are mandated it for the whole of the public health workforce. As of today, we are mandating it for the whole of the private health workforce and primary and allied health care, and they must be fully vaccinated by the 15th of December. And we have mandated staff across a whole lot of sectors that we know are most at risk because of the density of people coming into these venues. And we know from the evidence over the last 2 years that they're also sites that transmission happens quite quickly. So that's why we've mandated the hospitality businesses, museums, footy stadiums, all of those sorts of places. We know they're the greatest risk when the virus starts moving through the community.
And what date in January is it expected that Queensland will be 90% vaccinated?
We don't have a set date. When we hit 90% is in the hands of Queenslanders. Queenslanders could hit 90% in 4 weeks if they wanted to. If everyone who's unvaccinated and eligible were to come out this week and get vaccinated, then in 4 weeks' time, 3 weeks for Pfizer, 4 weeks for Moderna, if in 4 weeks' time they come and get their second jab, we're at 90%. It's that simple. We can control when we open up and when we hit 90%. So come on, Queenslanders, we can do this.
Minister, some businesses are saying they're not going to abide by the vax mandate unless it's legally required. Is it mandated?
It is legally required. A public health directive is a legally binding directive. It can be enforced by law and fines can be issued by the police or liquor or gaming, depending on the enforcement officer.
Will those rules definitely be dropped once the state hits 90%?
What the Premier has said in the plan that we have released is that we will review it at 90%, but let's get to 90% first. We haven't even hit 70% double dose yet. This will come in at the 80%. Why at the 80%? Because that's when people from interstate will be coming in and not having to quarantine. So that's when the greatest risk to our communities occur, is from the 80% mark, and then we will review it after that.
Do you think the new vaccination rules will lift the vaccine figures, and was it the hesitancy that prompted these new rules?
Look, there's a range of reasons why we made the announcement we did yesterday. Firstly, it's about rewarding people who are vaccinated and saying that you want to be able to go out and enjoy yourself knowing you're vaccinated. And so we want to give the people who are vaccinated the confidence to go to a pub or a club or a cafe and know that everyone else there is vaccinated as well. But we also want to make sure that when you're walking into an aged care facility, you're not putting those vulnerable people at risk by potentially bringing the virus in unvaccinated. So it's looking after our community as well. It also slows down the spread of the virus by mandating the vaccination in these sites. We also know that it will help business keep their doors open, because if you're a small business, and we know how quickly Delta spreads, if you are a small business that has one person who's infected, the likelihood of the staff who work directly in contact with them getting infected is extremely high. The Indooroopilly school cluster, we saw 100% transmission through households. Everyone in the household got it. So that would mean a business would have no staff to operate. So by requiring the staff to be vaccinated, it means businesses will have the confidence that they're less likely to have an outbreak amongst their staff, and they'll keep their doors open, which we know is so important for supporting people's livelihoods, incomes and our economy.
What will happen to businesses that do allow unvaccinated patrons in?
Look, the police made it clear yesterday that they will start with an educative approach, as we have over the last 2 years, going to businesses, checking whether they are inadvertently letting people in. They've got to take all reasonable measures. Where they deliberately allow people to come in, then the police can be called in, the police can take enforcement action. Those will be decisions of the police or other enforcement officers like the Office of Liquor and Gaming, but there can be fines attached to that.
Minister, what about the businesses, particularly up here at the Far North, that are facing staff shortages at the moment that will have to let people go? Have you thought about that aspect?
Look, absolutely, and you know, with all of this, we will look at essential areas and what is required as far as maintaining businesses. But let's be clear, a business who's got staff shortages now, what happens if that business that have 4 staff all get infected, or even one get infected? That business will shut its doors for weeks because their staff are infected. So instead of losing 1 or 2 staff because they choose not to get vaccinated, they could end up losing all their staff because they've got an outbreak. That is the reason why we mandated it across the health system. If it means that some staff choose to walk away because they don't want to get vaccinated, that is still less of a burden on our health system than if we had a major outbreak through the Cairns hospital and we didn't have staff to man beds or staff to do elective or emergency surgery.
Will there be government help?
Sorry.
There's a big push from industry for us to open international borders to 80%. Would this be considered?
We've outlined our plan. We are clear on what our plan is. We want to do this gradually. If we are to open up to everyone at 80% with no quarantine, that is a very big risk all at once. It's not a risk or a burden that we are willing to take to put on the people of Queensland. So let's do this gradually. Let's do it sensibly. At the 70% mark, we'll allow anyone from interstate who meets the criteria to fly in and home quarantine. That is a big shift in our policy. At 80%, we'll let the same criteria, we'll let everyone come in as long as they're fully vaccinated and had a negative test and not have to quarantine domestically. But internationally, we are aiming for that 90% because that's when we can have confidence that more of the community will be protected.
Will there be government help for staff that are let go because they don't get vaccinated?
No, we're not proposing any particular support. Let's be clear, as Minister Crawford just said, the Premier has said, this is not being forced upon a staff member. You have the choice to get vaccinated or not. If you work in aged care right now, you have to have the flu shot. If your child goes to daycare, they have to be immunised. This is not new. We require our children in daycare to be immunised right now. We require staff who work in aged care hospitals to have the flu injection. So what we are asking is to keep yourself safe and to keep the community safe by getting vaccinated. It is your choice.
Thank you.
Thanks, everyone.